Good afternoon, and welcome to the National Family Support Technical Assistance Center's webinar, Families Make Your Voices Heard, an Introduction to Advocacy, presented by our partner, the Partnership to End Addiction. I'm Gail Cormier, the Project Director of NFSTAC, the Family Center of Excellence. We are led by the National Federation of Families. I want to thank you all for joining us today. Before we introduce today's presenters, I would like to go over a few housekeeping items. Today's webinar is being recorded. The recording, along with the PowerPoint presentation, slides, and any additional resources, will be sent via email within 3 to 5 days to all who have registered. We ask that you remain with your video and audio off during the presentation. If you have any technical difficulties during this webinar, please type your comment in the chat box on the right side of your screen, and someone will be able to assist you. Please also type your questions for the presenters in the chat box, and if we have time at the end of the presentation, we will ask as many as we can. We will be watching the chat during the entire presentation, so just if you have a question, just ask. The webinar will end 10 minutes before the hour. We ask that you take this time to complete a short feedback survey using the link provided. This survey will help us continuously improve our webinars, and it also fulfills our SAMHSA funding obligation to provide them with important data required by our contract. Please note, all information will be confidential and we will respect your privacy. Please know that we do not offer CEU credits for our webinars, but we'll send you a letter of attendance within 3 to 5 days after the presentation. I would like to thank SAMHSA for allowing us to share this information with you today. And again, thank you all for coming and joining us. I will now turn it over to NFSTAC's Principal Investigator and the Executive Director of the National Federation of Families, Dr. Linda Gargan.
Thank you so much, Gail, and thanks to all of you who are joining us today. This is a very exciting day for the Technical Assistance Center, as this is our very first webinar. So thank you for being with us. We think that you are going to be very, very pleased with the information you receive. And let me introduce you to our presenters who will be sharing their knowledge and expertise about advocacy. We have Marcia Lee Taylor and Denise Mariano with us today. Let me introduce Marcia to you first. Marcia is the Chief External and Government Relations Officer at the Partnership to End Addiction. She oversees the organization's relationships with government agencies, elected officials, and key stakeholder groups, as well as all fundraising and development efforts. She also manages the partnership's advocacy work and national network of parent advocates. Marcia formerly served as president and CEO at the Partnership for Drug-Free Kids. Prior to that, she served as the Senior Advisor for Drug Policy and Research for the Senate Judiciary Subcommittee on Crime and Drugs, as well as the Democrat Staff Director of the Senate Caucus on International Narcotics Control, working for then Senator Joseph R. Biden Jr. Denise is the Director of the Family Support and Advocacy for Partnership to End Addiction. She is motivated by the belief that families can be part of the solution. Denise has dedicated her personal and professional life to helping families impacted by substance use disorder. She has been a strong voice for families at the national and state level since 2011. However, as she speaks with you today, you will find that she has been a parent and family member with lived experience for much longer than that. Denise was selected and honored at the White House in 2015 as an advocate for action, where she was recognized as one of the leaders across the country making a difference. She was also selected as a National Council on Alcoholism and Drug Dependence advocacy leader for her efforts in New Jersey. And with that, I will turn this over to Marcia and Denise.
Fortunately, my screen is frozen and I'm not able to. Oh, there we go. Okay. Thank you so much for having us here today, and thank you everyone for coming. Denise is going to start us off.
Thank you, Marcia. I thank you as well. What a wonderful opportunity for two organizations to serve families to come together, and super excited for this. So a little bit about the partnership. We used to be the Partnership for Drug-Free Kids. Some of you might know us as that. And also we merged with CASA New York about 1.5 years ago. Our goal as a combined organization today is to empower families, advance effective care, shape policy, public policy, and change culture. I just came off a different meeting. Sorry about that. Marcia, if we could just go to the next slide.
Yeah, I'm trying. There's I don't know why this is not.
So while Marcia's going to that next slide, maybe I'll just speak to the work that we do. So thank you, Marcia. We don't do this work alone. As we said, families are at the center of our work. However, we partner with providers by sharing best practices and educational resources. We partner with schools and communities by training and giving them resources for their target audience. And we also help share that knowledge about families. Too often families are not considered as part of the solution. If we look at this, it takes a village. And so we help educate them in that area. And finally, we partner with policymakers to influence and implement humane, effective solutions that help families and individuals struggling with substance use. Family services. Today's presentation is about advocacy, but just to give you a little bit of insight as to the resources we have for families. And those resources are 100% free for families. We have a helpline where master addiction specialists and social workers kind of meet families where they're at, kind of do some hand-holding there and help them support their loved ones. Our signature Help and Hope by Text program offers resources to skilled families to deliver text messages. Those are text messages that come to our families throughout the day. Some are to inspire hope, while so many of the other ones are just to help educate those families, depending on what personal tailored track they're on. An example of that would be if their son, daughter, or loved one was struggling with opioid use, we might connect them to naloxone resources, harm reduction resources, non-opioid alternatives, and so forth. And then we have trained community organizations as an evidence-based strategy on how parents and caregivers can improve and communicate about substance use and learn skills to encourage healthier choices. In layman terms, it's how we speak to families and help them help their loved one by listening and being part of the solution. These are just the numbers from 2020 of the families that came through our doors. Sadly, that number is 15,000, but we're so grateful that they were able to find the partnership, whether it be through our online support community, helpline, our parent coaching, which is our peer program, our e-learning modules, which are self-paced, and Help and Hope by Text, which I just discussed.
Great. Thank you, Denise. So we're really excited to be able to talk to all of you today about advocacy and how we can all work together to lift our voices to create change. So we're going to walk you through a number of different advocacy tools and really some big picture items as well. The picture you see on the right of the screen here is our advocacy toolkit. And in the email that will go out to all participants afterwards, there'll be a link to that. And I invite people to take a look and kind of dig deeper. And all of this information that we go over today is really in vivid detail in that advocacy toolkit. So really, to set the stage, what is advocacy? Advocacy at its heart is really making the case for a cause and then building support among like-minded people in order to influence elected officials and policymakers and create the change that you want. For us at the partnership, it's really providing a voice for families and making sure that the perspective of families is really present in policymakers' minds as they're making various decisions. So we want to educate them about the problem and influence them to do the right thing and make the changes that are necessary. Advocacy can take place at absolutely any level. So, I think people need to be open to the fact it's not just, going to Washington and meeting with members of Congress. It can be done at the community level, the state level as well. And, as we've learned in the past year, so much can happen virtually, and you don't need to necessarily be there in person in order to make your voice heard. So we'll talk about that a little bit later. And just as we love this at the partnership, we love this quote by Margaret Mead: "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has." And that's really our guiding principle of why we want to get families banded together to really be able to offer that perspective and really open policymakers' eyes to the stumbling blocks that are in families' way when they're looking for help for a loved one.
Mm-hmm.
So advocacy can take on a number of different forms. And I think, especially for those who are new to advocacy, I think it's really important to kind of think about things on the scale of small actions all the way to big actions. And all of them are really important. So don't think that you just have to be testifying in front of a committee on Capitol Hill in order to make a difference. There are so many small things you can do while you're sitting in front of your computer at home that really can make a difference. So these can include posting on social media, signing a petition, writing a letter to the editor or an op-ed, meeting with, calling, writing a member of Congress, and attending a hearing or a town hall. So we're going to walk through a number of these as we progress this morning in our webinar. Denise, do you want to take this one?
So this is one of our, just a powerful quote from one of our family volunteers. I'm just going to read it out loud because it's really inspiring, especially for those who maybe feel like they are alone, right? And to become not only to maybe share your story, but feel part of a community. So advocating for families whose loved ones are struggling with addiction connected me to an ever bigger family and community. And I finally discovered I was not alone. Very similar to my journey, where I was just connected. Not only did I not feel alone, but connected to those where I was just hardwired, right? And the silver lining there is just meeting families across the country, learning from each other, collaborating with each other and sharing information. So we build each other up at the same time. So next, Marcia. So why substance use and mental health advocates need to work together. It is a lot about our messaging and timing and being louder for more impact. And I think it's also an education opportunity. Maybe some of our policymakers often think of mental health in substance use in silos, right? When many of us working in this field or families, just that personal experience is, there's a whole lot of co-occurring behaviors going on here. And so I think we're lockstep in many of our advocacy efforts, but what an opportunity for us to help educate our stakeholders and policyholders on why we need to work together and how closely related substance use and mental health is. And the legacy of anonymity presents a challenge to lifting our voice and telling our stories. If we are silent, we can't create change. Really powerful. Marcia, I'll let you talk about the dollars.
Yeah, so it all became very clear to me that if we're silent, we can create change. I think is so important. So I was at a conference a couple of years ago, and there was a member of Congress who controls the entire budget for the Department of Health and Human Services, an appropriator who are sort of known as the big power players on Capitol Hill, the appropriators, and they make all the funding decisions. And he said something to rally the crowd. He said, you know, when I propose cutting funding for other diseases, people stop me in the grocery store. They are knocking down my door in my office in Washington and in my district. They're, you know, the phone's ringing off the hook, letters are pouring in. When I propose cutting a program that pertains to the issues that you all care about, mental health and substance use, there's not a peep. There's silent, and everyone's silent. And he said something that has stuck with me. He said, "You all make it really easy for us to cut when we need to make budget cuts, to cut from your budgets." So that really, to me, was a rallying cry that you know, we need to be loud and we need to be heard and we need to stand up and make sure that policymakers know how many families are affected by these issues and how reliant we are on the government programs that really are the support structure for so many services that are out there. So, you know, I think I ask everyone to think about that as we go through the next slides and talk about things, just sort of as a reminder about how important everyone's voice can be here. And on that note, you know, I think a lot of people are intimidated by advocacy because they say, you know, I can't recite all of the latest data, or, you know, I haven't written a research study, you know, why should someone listen to me about, you know, my family story? And really, from my years, I spent 11 years working on Capitol Hill, and the takeaway for me was really it's data plus stories that equal policy change. And at the partnership, we really look at that as our recipe for policy change. And you know, obviously the data and the stories need to match up. But if a member of Congress or a staffer hears a story about, let's say, insurance parity, and or they see data about insurance parity and the fact that insurance may not be covering all of the services for mental health and substance use, you know, that's going to be persuasive to them. But if that's coupled with the story about how a family has been impacted, and maybe even lost a loved one or almost lost a loved one because of that lack of insurance coverage, that's really going to stick with people. And that's really what's going to motivate policymakers to want to make change and really to put a human face on issues in a way that's very tangible.
So this is just another powerful quote from one of our family members. As Marcia just shared, the data and stories are what seems to be working as the combination to really help change public policy. But what we know through experience and from so many of our family members, that it's truly the personal stories that bring this issue, whether it be substance use or mental health, to life. Stories provide an integral insight, lend importance to the issue, and demonstrate how the problem really affects us real people. I think too, in sharing, you know, Marcia just brought up, parity and lack of insurance. It's when we share our stories that we use our own personal voice and really bring that messaging, and not speak necessarily to parity, but in sharing our story, we can also share what that looked like for us, right? It's not just denial of treatment. Maybe it's, 3 days of treatment when they should have had 30. Again, it's just really powerful to humanize the issue that's on hand, and also helps to reduce the stigma that stifles our voices so often. Okay, Marcia. So today we're going to, as we continue the presentation, we're going to talk about different advocacy tactics and speak to those low lifts, medium, and high. So many of us, as Marcia said, come into this and say, you know, I want to be an advocate. I don't know where to start. So I hope at the end of this presentation, you'll get a feel for the different ways you can get involved. What I can share with the families that are on this webinar is, for me, that looked like one simple social media post. I found the courage, or I found that I was worthy enough to make that one simple, you know, tweet. And that was 10 years ago. And here I am presenting to you very nervously, but it just really shows how we can start with those low lifts and really go at our own self pace. So Marcia, if we could just go to the next slide. So we have many low lifts on advocacy due to timing, and just we thought we'd concentrate on action alerts and social media as a way to engage our policymakers. In these two examples, you do not need to know your officials.
Right, and this is right here, this contact form that you see on the right side of the screen is literally all you need to know in order to be able to reach out to a policymaker. So I know the partnership has a number of action alerts. A lot of other organizations have them too. And if you plug in your name and address, it will auto-populate your member of Congress, or sometimes other organizations. We operate mainly at the national level. Other organizations will have this at the state level or even the local level, where you can reach out to policymakers and really not have to know anything about them.
Mm-hmm.
You don't have to worry about, what if they ask me tough questions? Do I have to defend something? It really is something that is, it's, you know, easy peasy to be able to just plug in your personal information and be able to send off a letter on an issue that you care about. And, you know, obviously not all action alerts are going to be relevant to you or to what you feel is important, and that's okay. You can, you know, take what you like and leave the rest. And and you know, I know those of us at the partnership invite our advocates to do that. I think most organizations feel that way, and it's a really easy entry level way to begin having your voice heard. And also just, you know, make sure that they're, you know, usually organizations put out these action alerts in a timely manner, so it's, you know, trying to either build support for a piece of legislation or get it across the finish line or stop it, as the case may be. So really important also, you know, in terms of timing, you don't even need to think about, you don't need to be watching the bigger issues. All of that is done for you. You just need to plug in your name and address.
So social media, I think I hit upon that with my own little nugget of in my personal story. Really powerful, low-lifting way you can start to get involved. So, for example, tagging your legislators in your post on an important policy issue, following those legislators on social media, which will give you insight into their position, commenting on their post. An example of that might be, let's say they co-sponsored a bill that's really important to you. I'm just thanking them, right? So that when the funding comes along, maybe we can go back and remind them and thank them again for co-sponsoring, and then urge them now to support the funding. If you don't feel comfortable sharing your own thoughts, you can retweet both from both our organizations. The staffers are watching this, and they can see the power in social media. Really low lift, 30 seconds. And as Marcia said, what's important to you? Here's just a couple of examples of some social media posts. Again, it's what you're comfortable with. You can start out retweeting, or maybe share a nugget of your personal story in that thank you. You know, maybe, unfortunately, it's like, I lost my son, but I thank you for, you know, the future families that are struggling with addiction. Again, just a really easy way to get involved in advocacy.
Great. And so now we'll go on to some of the actions that require a little heavier lift, to walk you through attending a town hall, writing a letter to the editor or op-ed, making phone calls, and sending more personalized letters or emails.
So town halls, I'd love to preface this by saying what a silver lining there that has happened due to the pandemic. And I know we don't think in those terms often enough, but I think as we just go over this slide, there's much opportunity now to attend these town halls virtually, that it doesn't require a trip to DC or actually even at your local community. Many of our representatives are holding forums at the local level virtually. So really has been a silver lining in getting more voices out there at those meetings. So town halls are a forum for elected officials to give updates and hear from them. You can read that quote below, really powerful and really lends to how important our voices are at that table. I think it also provides a great opportunity to ask questions and introduce yourself as a member of that community. They remember you when you come back and again. And it's also an opportunity to maybe just, again, share that nugget of your story very briefly. And also just a potential of, after that town hall, similar to the social media, emailing them, thanking them for having that town hall, and then reminding them how critically important it is to support the issue that maybe you asked that question. So I think another really great opportunity here is this is an opportunity where you meet so many that are maybe traveling the same journey as you, different people at the local level, maybe the person next door, right? You're all coming to this town hall, and what a wonderful opportunity to connect with each other and create even a louder voice. Hey, Marcia.
Yep. Sticky screen again. There we go. Okay, on to letters to the editor and op-eds. So policymakers, are always reviewing newspapers and all sorts of media, particularly in their districts. They want to see what the top headlines are. Oftentimes, a lot of legislation is reactive to top headlines and to conversations that happen there. So I think it's this is a really important way that people can make their voices heard. Letters to the editor, are very easy to do. They're always done in response to a recent article. So again, you don't need to be an expert at something to be able to weigh in. And it can be, it can be sort of just giving your perspective or presenting an alternate perspective to what was presented in the news article, or calling out disparaging language that could be used in a news article. So every publication has their own guidelines on length and how to submit a letter to the editor, but I really encourage people to use this tool. It's fairly easy to get them published, either in the paper itself or online, and it's a really important way to sort of get your name out there. Oftentimes, reporters who are looking for sources for stories will turn to letters to the editor to say, "Hi, I wonder who's weighed in on this recently," whether from an organizational point of view or an individual point of view, and it's a great way to insert yourself into the conversation fairly easily. An op-ed is a slightly heavier lift. They're longer format, generally 500 to 650 words, but again, every publication has their own guidelines on this. And this is a way that, that data plus stories recipe can also be very useful. Inserting that personal story, I think, gets people's attention. It's a great way to open up an op-ed and then back up that story with data. Generally, op-eds, it's easiest to place op-eds or get a newspaper to run an op-ed when it's in response to a news hook. So, for example, at the partnership, we did an op-ed on the opioid crisis right after Melissa Etheridge unfortunately lost her son to an overdose. Those kinds of things where people are talking about something, and therefore a newspaper wants to have some sort of relevant, timely piece of content. It's always great to end with a call to action and be really specific. Maybe you're calling on policymakers to make some changes, or you're calling for more funding for something, but just having that specific call to action at the end is really helpful.
Mm-hmm. All right, so I'm going to talk a little bit about phone calls. Can be really important as a bill is nearing consideration or a vote. I can remember back at just a little personal nugget again of when CARA, the Comprehensive Rejection Recovery Act, was being voted upon. And there were so many calls that we kind of broke their telephone system down. So really powerful. So that was a combination of two things happening, which is not represented on this slide, but all those bills happening, plus think of that social media that we spoke about, right? Just putting that simple, I just called my representative, which can be found here, to tell them, you know, how important this issue is. So when you make those phone calls, we mentioned our recovery advocacy toolkit. You'll find a script in there that you can help personalize the issue that you're working on, but primarily you're going to want to make your specific ask, outline the issue and explain the importance and impact. This would also be a good place to include your personal story. Again, we keep on coming back to that personal story, regardless of which tactic or level we're working on, because we know that those personal stories really bring life to this. And coordinating calling campaigns can be an effective way in ensuring legislator knows where constituents stand. Again, just that simple combination of phone calls, the fact that you made a phone call, and sharing that on social media. Okay, letters and emails. As this slide indicates, you do not need to wait for an organization to organize an advocacy campaign. You can write your own letter. We know that personalized individual emails can have more influence sometimes than that regular form letter. Again, that personal nugget that really might help change hearts and minds out there, right? It could be that really low, not low, but that personal story that changed hearts and minds. And nearly all congressional staffers said letters would influence an undecided lawmaker, whether sent via email or via mail or email. I remember, again, I keep on bringing my own personal, because I know there's lots of families on here, and from someone, again, who thought, I can't do this. I remember my first letter, and it was just a paragraph about our son. What were the policy and gaps in his treatment, and the fact that he was in recovery today. So sometimes those letters and emails can not only, you know, of course, ask them to support a bill, but thank them. There was a bill passed that was really instrumental in getting my son health care for the first time in 6 years after parity issues. So again, that small story.
Yeah, and just one bit of color to this. So every congressional office has a team of people who just work on correspondence, and they are reading all the incoming correspondence. They give the elected official a weekly tally of who's writing in, calling in about whatever issues, and it can really help catapult an issue that's not on that elected official's agenda to really being part of the agenda. So, you know, if someone's writing in about a particular bill that affects either mental health or substance use that elected official doesn't have a profile on, they're going to ask for a briefing on that. They're going to say, tell me more about this. Like, why are all these people in my district caring about this? I need to know more and be on top of this. So that's a way that this sort of steady pounding at an issue and really working together with other like-minded folks can make a huge difference.
So this is where we're going to get to the heavier lifts. For today in this presentation, we will focus on meetings and building relationships with staff, but just wanted to reiterate here that, again, that silver lining that we don't have to travel to DC today, so there's more opportunity, but here's just a few examples of the heavier lift, and Marcia's going to discuss building relationships. and legislative meetings.
Yeah, so, as Denise mentioned, you don't have to travel to DC. Every member of Congress, every senator has local offices throughout their district, throughout their state. Same with state officials. They will have an office in the area that they represent, and it is just as impactful to meet with someone in the home office as it is to meet with someone in DC. So when you're going to, and again, the advocacy toolkit sort of walks through all of this in vivid detail, but it's always important to kind of figure out why you want to have this meeting, what you want to accomplish. You need to reach out and schedule something. It's not always with the policymaker, and that's okay, because the staff have a lot of sway as well, and they do a lot of work behind the scenes. So it's just as important to meet with the staffer and have a conversation with them. Even if you meet with the member of Congress or the senator, following up with the staffer is really important. They're the ones you're going to be able to get on the phone later, and the elected official is going to be harder to communicate with one-on-one. But it's important to research and prepare. When I was on the Hill, it was always, great when someone knew where my boss had been on an issue. So they weren't trying to educate me about something that, he had written all the legislation on. They sort of knew that his record on something and came in prepared. Again, really important to share personal story and connect that to clear facts. Always have a clear ask. That's what staffers and members are listening for as they're talking to someone. Obviously, they're listening to your story, listening to what you have to say, but their ears are really attuned for what's the ask here and what is this person wanting me to do. It's always important to offer to be a resource. People are always looking for someone to call in the district to kind of get their finger on the pulse of what's going on in a particular issue. So building that relationship to be that resource is really important. Leaving a leave behind with materials, more information. It doesn't have to be something that you can create. It can be something, if there's a fact sheet on a particular issue that the partnership has developed, or maybe another organization has developed, that's a great thing to leave behind as well. And then important to follow up, say thank you, and keep in touch. Two keys to success with legislative meetings. One, knowing how to tell your story succinctly is really important. And then two, that ask, being really clear about the ask. 88% of congressional staffers, as you see on the side graphic here, said that it would be helpful to have a specific request, but only 59% report receiving them on a regular basis. So that's really a missed opportunity if you don't have that specific ask. And then get the staffer's card, follow up, as I said, offer to be a resource, and really build that relationship, because that's your key, your way into that policymaker's decision-making process and influence with them.
And one of almost, Marcia, do you want to take this? Or
no, you
it's
go
just,
ahead, Denise. No, you go ahead.
This excites me, this little simple title, but we can do this. What's really exciting about today is to really collaborate with those families in the mental health space. Again, like I said before, to bring our voices together from a place of substance use and mental health. Just the power in that collective voice. And then to have two different organizations collaborating together on that expertise on the mental health and substance use. This is really important, and I'm so grateful that we could bring this audience together today. We're going to share some resources with you either at the end of this presentation or within our email. Follow us both on social. Maybe you're not ready to lift that voice just yet, but just following us and following the work that we do, and maybe some policy issues are out there. I can think of saying, again, not thinking I was worthy, right? But just I was like a sponge when I started following people on social media, and that ability to just get some foundation and some general knowledge, but that again, powered with my own personal story, is what made me kind of come out of the hiding and start this journey organically. So super excited that we can do this together.
Yeah, and I know we presented a lot of material today, and we went over it really quickly. So again, our advocacy toolkit is a great guide to that you can download and really look through for reminders about all of these things. And again, you know, as Denise said, following our organization online and the National Federation of Families to, you know, get more information about the issue that you can share and really use as the basis of you know, lifting your voice and being an advocate.
Mm-hmm.
In terms of follow-up and next steps, as everyone mentioned at the beginning of the presentation, there will be a follow-up email and links to additional resources and way to stay connected. So we look forward to keeping the conversation going. And I think now we turn it back for the survey.
Hey, well, thank you very much, Marcia and Denise. We have a couple of questions. We have a little bit of time, if that's okay.
Sure.
The first question is from Bill Williams. Are there any particular organizations you believe are the most effective and sensitive for potential advocates to engage with?
Besides the two of us?
Yeah.
I'm just kidding. So hard question to answer. Of course, I'm going to throw ourselves in there, right? Again, because of the family voice, our expertise, the 30 years, but really hard to answer. Maybe for those listening, kind of seek out maybe some of your local organizations and see what they're doing, whether they're your local DFCs or community coalitions, see what the work that they're doing at that level. What's really nice, and another, what we do at the partnership is maybe you find that local organization where we could be that bandwidth, right? So that they can share our resources in addition to their local advocacy resources. So, so to Bill Williams, I'm sorry if I kind of patted us on the back, but again, I think it really takes, and here's what I can share with you. I think it takes a lot of research by an individual and really feeling that trust with them, whether it be through their work or through their voice. That's how it worked for me. Lots of research and really ending at outcomes which were startling and maybe unethical, right? And just collecting a group of organizations that I felt in my heart I could trust. So I hope that was helpful. And
Denise, do you have any specific examples of an ask for legislators?
Sure. So for me, I'll give a personal example. So our son, for example, was denied any care and denied insurance for 5 years. So obviously, parity was a really important issue. So that was probably my second advocacy effort to fight for parity. It's the law. Families need to it's not a privilege, it's a law that they should get health insurance treatment, right? So that was the first one that I fought for. Another one might be, I know I can't get into, specific bills, but maybe you care about naloxone, right? So maybe you care about expanding access to naloxone. Maybe you care about the Good Samaritan law where people can call to help their loved one, but not be in fear of being arrested if they're at a party together. Like, let me help and save my friend's life. I won't be arrested. There's a whole gamut. And if anybody wants specific requests and some more examples, please feel free to reach out to us.
Yeah, and we have an advocacy page as well on drugfree.org with links to action alerts about a lot of issues. Another issue that's very front of mind for us is a program to help bolster family support groups throughout the country, and provide federal resources for them. So, you know, you can find out a whole lot more. Our website is drugfree.org, and you can go to the Get Involved page, and there's a Be an Advocate tab, where you can find out a lot more about all of these issues that we at the partnership are advocating for.
Well, thank you. Christine LeBeau has a question. She says, I work with the brain injury community. This often overlaps with addiction. New York State does not track data. We are often asked for it, but without the state keeping track, is there any way around it?
So it's a really good question. I mean, I think
No.
that that data is a really important part of it. You know, I think that if you can collect even an impression of the number of people in your community who are affected by this, and then go to the state and make the case for including this in a current survey, that could be important. But even just you know, getting people to raise their hand and be counted. I mean, we see that with insurance parity, the numbers of families who say that they've had issues with insurance is super low, because a lot of families are in the thick of a fight and for their child's life, and they're not worrying about filing a complaint with the state insurance officer, right? So the numbers are really low. So that's why the stories become even more important, and urging people to sort of raise their hand and be counted, and show policymakers and companies that this is an issue, in the absence of hard data demonstrating that it's an issue. So I think that you have to kind of be creative about ways to raise awareness and be seen if there isn't a great source of data available.
Well, thank you, Masha. I'm afraid that's about all the time we have for questions, but now I have a personal favor for you. If everybody could go into the chat box and click on the survey link and answer the surveys, this would be extremely helpful. Not only to tell us how we can do better, but also this will fulfill our SAMHSA obligation too. So if you look down there and click on the link, please fill out your survey. Thank you, everybody.